Hello, and welcome to the Multnomah County Medical Reserve Corps. Before we get started, I want to say thank you for joining the Medical Reserve Corps. This is part 1 of the orientation course. When you are finished, you will need to listen to part 2 to get full credit for the class. The videos will take you a total of about 25 minutes to complete. In this orientation, we will focus on several topics that will help you get acquainted with our Medical Reserve Corps program, or MRC as it is commonly called. First, I will share some background and history of the MRC. We'll talk about past activations of the MRC in our region and who can join the MRC. Then we'll go over the role of the MRC in emergencies and non-emergencies. I'll also go through all the training and health screening requirements. Finally, I'll take you through how an activation of the MRC works from start to finish. Multnomah County's MRC was founded in 2002 and we began registering volunteers in 2003. As you probably already know, there are MRC units all over the country. But what you might not know is how the Multnomah County MRC fits into the larger nationwide program. At the top is the U.S. Department of Health and Human Services. Then there is the Office of the Assistant Secretary for Preparedness and Response. And then there's the Office of Emergency Management, the Partner Readiness and Emergency Programs Division, and the National Medical Reserve Corps Program. Phew, that's a lot of federal agencies. But let's get a little closer to home. The Oregon Health Authority manages the State Emergency Registry of Volunteers in Oregon, or SERVOR, where all MRCs in Oregon sign up. And the Multnomah County Health Department maintains a local MRC unit. That's the unit you're a part of. We work closely with the state program, but both the state and local programs work closely with the national MRC program. Now let's talk about the roles of MRC volunteers during different types of events. The mission of our MRC is to strengthen public health and healthcare response to public health emergencies, but we can also use the MRC to support local public health initiatives during non-emergencies. I'm going to go over the MRC's role in both situations. Emergency response roles for the MRC include mass dispensing operations with public health, which I'll talk about more in a few minutes, assisting with shelter operations, and any other needed county emergency operations. During non-emergency events, the MRC can be used to enhance preparedness in the community, mitigate health disparities, assist with disease outbreak investigations, and assist with other small-scale or pseudo-emergencies. A good example of this is when we activated the MRC to work at lead screening clinics in schools in 2016. One thing to note is that we will never pull MRC volunteers away from existing emergency response roles that you may have. You should also know that the MRC can be deployed by public health as well as some of our response partners. We have many response partners throughout the region who could, if needed, request MRC volunteer support during events, including all the hospital systems throughout the region, Multnomah County Emergency Management, and the cities of Portland, Gresham, Troutdale, Wood Village, and Corbett. We also work alongside other responding agencies during incidents, training, and exercises, including the Community Emergency Response Teams, or CERT, and Neighborhood Emergency Teams, or NET. These teams are great volunteer programs you can also get involved in your community. We also work with the Red Cross and statewide and regional MRC units. Let me show you some pictures from some of our MRC activations over the past few years. Hurricane Katrina evacuation, called Operation Welcome Oregon to assist Hurricane Katrina evacuees. Several years of Project Homeless Connect at the Convention Center, offering health and medical services to some of our most vulnerable citizens. H1N1 pandemic flu response in 2009. MRC volunteers worked in flu immunization clinics and answered calls at our call center. 3 years of seasonal flu immunization clinics for uninsured adults from 2012 to 2014. During our lead screening clinics in 2016, volunteers helped run all aspects of the lead testing at 2 schools in Portland, and many drills and exercises over the years. Let's talk about who can join the MRC in Multnomah County. This is important because not every county in Oregon has the same criteria. At this time, we only accept licensed healthcare professionals who hold an unencumbered license. That license must be overseen by a state licensing board that conducts at least one criminal background check upon initial licensure. Most of our state licensing boards conduct criminal background checks more often than that. We have over 500 MRC volunteers registered in Multnomah County, including individuals from all of these professions. Take a moment to scan this list and see if you know or work with people in these jobs who you think might like to join the MRC too. Our greatest recruitment tool is you, our volunteer. Currently, our volunteer pool looks like this chart. You can see we have a lot of physicians and nursing professionals, and our numbers are growing every month. We'd love to recruit more people from all of these professions. If you've ever taken an Incident Command System or ICS course, this diagram is probably familiar to you. Most organizations use ICS to manage emergencies. ICS is all about ensuring the safety of responders while providing the most efficient method for response. The MRC usually falls under the operations section. Sometimes the MRC might work under the PIO if a call center is needed. In emergencies, one of the two most likely MRC volunteer deployments you'll encounter is the point of dispensing, or POD. A POD is a fast and efficient way of delivering medication or vaccine to a large population. It's a general blueprint of how to run an operation and has specific procedures that can be scaled to fit any size event. Our flu clinics over the years are run like pods. Our lead screening clinics were run like pods. The health department offers various opportunities for training and exercising in pod operations. Another likely deployment for the MRC is to work in a medical support call center. When a public health emergency happens, there is always a large volume of questions from the public. When local public health's capacity to respond to those questions is exceeded, we may open a call center. We would use MRC volunteers to staff that call center and answer questions from the public. We opened a call center during the 2009 pandemic flu and could also use this public information strategy during any large outbreak, bioterrorist incident, or other large-scale emergency. Now we are ready to dig into the training and health screening requirements for MRC volunteers in Multnomah County. We will go over each requirement now, but a full list of all the requirements is available on our website. The first training requirement for any emergency or non-emergency activation of the MRC is to complete this orientation course. Good news, you're almost done. You will also need an ID badge in order to volunteer for any activation. The state Servor program makes badges for us. In order to get a badge, you will need to email us a passport-style photo so we can upload it onto your Servor profile. The photo must be a head and shoulders shot taken on a white or very light background. No selfies or action shots, please. If an emergency happens before you get your badge, you could just wear your work ID, but we'd like to make sure all new volunteers get badges within a couple of months after completing this orientation. Once you email us your photo, you can expect to receive your badge in the mail in about 1 to 2 months. We also require HIPPA training for any emergency or non-emergency activation of the MRC. While some of you are required to do HIPPA training for your employers, as our volunteer, we are required to have you complete the Multnomah County Health Department's own HIPPA training within 12 months of any deployment. The HIPPA training consists of several short videos and a self-verification form which you can find on our website. All volunteers must complete the HIPPA training before they are accepted into our MRC unit and every 12 months after that in order to be eligible for deployment. Finally, we require verification that you have completed a bloodborne pathogen training in the last 12 months. The training can be done through your employer, or you can contact the MRC coordinator if you do not have access to a bloodborne pathogen training, and they will help you find one. We verify your bloodborne pathogen training through an online self-disclosure form found on our website. You only need to know the date of your most recent training, provided it was within the last 12 months. All volunteers must verify their bloodborne pathogen training every 12 months to be eligible to deploy. We also have an online form so you can self-verify some health screening requirements. Depending on the nature of the event, you may be asked to verify that you have been vaccinated for or are immune to measles, mumps, and rubella, varicella, and hepatitis B. You may also be asked to verify that you have had one negative tuberculosis skin test in your lifetime. For these health screening requirements, you do not need to provide a copy of your lifetime immunization record. In order to be ready ahead of time, you must complete the Medical History tab on your Servor profile or complete our online self-disclosure form. If your immunization status is unknown or you don't have access to a healthcare provider, our Occupational Infection Control Office can offer you a health screening appointment at your expense. We may also offer a declination form depending on the incident. Because emergencies can happen very quickly, it's important to be prepared. Complete all the requirements now. The full list is on our website. All new volunteers must complete the requirements before they are accepted into our MRC unit. Established volunteers must complete them before they are eligible to deploy in any emergency. We also have a couple of trainings you may be asked to do before deploying for the MRC. The 2 courses you may be asked to take are Incident Command System 100 and 700. Both of these courses are available online at the FEMA website. These online trainings are useful for understanding how we organize to respond to emergencies. You have now reached the end of Part 1 of this orientation course. Please continue to Part 2 to get full credit for the course.